How you doing?
Hello.
My name is Gus. I'm a nurse practitioner student with MSU, and today we'll be performing a neurological exam on today. And do I have your permission to conduct the exam? Okay. As we spoke right before the video started, you did tell me your name. You were aware of the place, so you are. I did assess that you were alert and oriented to person, time, and place. So now I'll be moving on straight to the exam. And for the beginning of the exam, I'm actually be starting with the cranial nerves, and there's 12 of them. And as I'm going along, I'll explain what I'm doing, and if I need you to do anything, you just follow along, please. So the first one's actually going to be, wrong one, is the cranial nerve number 1, olfactory, and it's going to assess your sense of smell. So I'm actually to include one side of your nose. I'm going to smell.
Cinnamon.
Okay, and include the other side. And what does that smell like?
Cinnamon.
Perfect, thank you. So since the smell is intact, for cranial nerve number 2 is the optic nerve. And what I'm doing is using my thalamuscope and coming in right side. So I put my hand on you, coming at a 15-degree angle. And I was assessing for the red reflex, which is there, and trying to look at the optic nerve in your optic disc. So same thing from the left side. All right, thank you. Sorry, bright light. And for the next one, I'm still gonna stay on the eyes. Cranial nerve number 2 and 3 both actually assess the pupillary reactions. So I'm gonna look for constriction and make sure it's good whenever I put light directly on them, and whenever I apply light on one pupil, I'm actually looking for constriction on the other one as well, which is the consensual reaction of light. So constriction went direct and consensual. Looks good for both eyes. And the optic, well, number 3 is called oculomotor. I should have said that first, but I did not. And the next one is also another eye exam. It is oculomotor, or cranial nerves 3, 4, and 6, which is oculomotor, trochlear, and abducens. And this one tests the oculomotor muscles. So in this one, I'm actually going to assess. I don't need an instrument, so I can use my finger actually. And we've actually done this in the HENT, and it's called the 6 cardinal fields of gaze. So I'm going to ask you to just keep your head still and just with your eyes, just try to follow my finger. Perfect. The next, cranial nerve number 5, your trigeminal cranial nerve. I'm gonna actually put my hands on around your jaw, and I'm gonna assess motor function first. So I'm gonna ask you to clench, and then just move your jaw from side to side. Perfect. Thank you. And then sensory, with this cranial nerve number 5. I actually have a dull side and a sharp side. I'll let you feel. And what I'm gonna do is I'm gonna place them. Just you look straight at me. You can just tell me which side you feel the dull or sharp.
Dull. Sharp.
Yes, ma'am. Okay, and then now moving from 5, I've already talked about abducens with the 6 cardinal fields of gaze. So number 7 is your facial. So with this one, how I assess is actually have you smile first, and then frown, and then puff your cheeks. Good, thank you. And then the next one is the acoustic cranial nerve number 8, which is the acoustic. So how I'm going to assess this one first, I'm going to do the whisper test before I go over here to my tuning part. So what I'm going to do is occlude one of your ears, and I'm going to whisper a 2-syllable word, and you just repeat what I'm saying. So,
Baseball.
okay, now go to the other ear.
Apple.
Good job, thank you. And now I can move on to the tuning fork. And this one we've actually done also in the HENT. It's called the Weber, where it tests for lateralization, where I put it on top of your head, and then the Rene, where I put it behind the mastoid, going behind the ear. So first one's the Weber. You tell me if you hear one ear or both ears.
Oh.
Awesome. And next one, the Rene. Tell me when you stop hearing it.
Okay.
Hear that?
Okay. Okay.
Sorry. Hear that?
Mm-hmm. Okay.
Perfect. Now moving on to cranial nerve number 9 and 10, which is your glossopharyngeal and vagus. This will test your ability to swallow, and I'm also going to look at your hard palate, soft palate, and your uvula. So just right off the bat, can you just swallow for me? Perfect, thank you. And no issues with that. Okay, and then I'm gonna take my pen light. I'm not gonna be looking inside your mouth, looking at the palates and the uvula. Say okay, I see the uvula. It is midline, so no deviation. The soft palate did rise as I was expecting back there, and the hard palate looks normal and intact. So next, moving on to cranial nerve number 11, the spinal accessory. So what I'm gonna be doing is actually put my hands on your shoulder and have you shrug against. Awesome, thank you. And then I'll put my hands on your chin and just have you turn towards. Good job. And then number 12, which is the hypoglossal. So I'm just gonna have you stick your tongue out just like this. And it is midline, so that's good. Any deviation, let's say if it deviates to the left, there would be an injury in the spinal canal, actually on the left side, so it deviates to wherever the injury is in the spinal canal. So yours is midline, so that's good, normal sign. So that's it for the cranial nerves. Now I can move on to the range of motion. And with range of motion, first off, I'm just going to take a look. As I seen you walk in, your gait was steady. It was even. Stance was appropriate. Posture indicates you have good normal musculature. I didn't see any deformities, obviously, in your upper extremities or lower extremities. I don't see any tics, no jerky motions, and I don't see any, like I said, deformities or muscular atrophy in your biceps or your triceps. So upper extremities look good. And so while I'm talking about muscular tone, I'm actually be raising both arms. And right here is I'm assessing also for the tone for any spasmodic movements or any rigidity or flaccid tone. If there's any flaccid tone, your arm would drop out of the way, but looks good normal muscular tone. Same thing for lower extremities. Let me try these. Look good, normal. And now onto the range of motion. First off, I'm gonna start with your hands, and now I'm just gonna be going to the fingers first, and then working my way up. So as I have your fingers fanned out like that, try not to let me close them, and I'm testing for abduction and adduction. And now close both. Don't let me go and try to spread them. Don't let me, there you go. Don't let me let you spread them. So it's good. And now, same thing. Hands out, palms down, and I'm assessing the wrist. So don't let me push down, don't let me pull up. Don't let me push down, let me pull up. And this will actually for the elbows and the shoulders. And speaking of the shoulders, arms straight out. This one's strictly for the shoulders. So don't let me push down, don't let me push up. Okay, then I'm gonna be coming in, assessing the shoulders. So don't let me push in and don't let me pull. Same thing on this side. Good job. And then now I can move on to the knees. And with the knees, I'm actually going to be pushing in. So you just go against my hands. Same thing, I'm going to pull out, and there you go. Good job. And while I'm on the lower extremities, I can assess here. Don't let me pull. Don't let me pull. And don't let me push. Don't let me push. And I can also assess for flexion and extension of the ankle. So there you go. Don't let me pull up. Looks good. Thank you. And I'm actually going to have you laying on your back. Assess the next one, which is the hips. So I'm going to have you bend this leg, and then I'm going to ask you to push up and pull, push down, and I'm going to assess the internal and external rotation of the hip. So wherever my hand is, just go against it. Don't let me. There you go. Perfect. Come on over to this side. Raise this knee. So push up, push down, assessing internal and external rotation. So there you go, and there you go. Thank you. Good muscular tone. Everything was equal bilaterally, normal muscular tone. I'm gonna have you. There you go, back there, sit it on the side. After that, now I'm gonna, that was part of my motor function. And now I can move on to coordination. So I'll actually have you standing for this one. And I'll be over here. And for the first part of this test, I'm just going to look at assess the gait. Like I said, I saw that when we walked in here that it was normal and steady and even. But I'm just going to assess for the coordination part of this exam. I'm going to come back. Looks good. And then some tandem walking. So I'm actually going to have you from heel to toe, walking in a line. That's good. And then come back. Gotcha. Now walk on your heels one direction, and then tippy toe on the way back. Looks good. Okay, and then a shallow knee bend. There you go. Thank you. And there's one that I did miss, and now that I seen you walking, it reminded me. I'm gonna do the Romberg test on you. So what I have you do is stick your hands out, palms up, and then close your eyes. And I'm assessing your balance and see if your limbs are upper extremities are actually able to stay out straight without dropping. They are. So go ahead and open your eyes. And this next one, I'm gonna ask you to close your eyes whenever I say go, and I'm gonna be applying some pressure. But let me see. Go ahead, close your eyes. And I'm seeing if your arms stay extended out and there was no drop, so it's good. So thank you. Everything was great. Now I'm gonna have you sitting back up. The next aspect is going to be sensory. And what I'm going to be doing is using various objects for this exam. So the first one I'm going to use is a Q-tip, and I'll be touching over different parts of your body and extremities. And there's actually a sharp and a dull side. So you'll tell me if you feel sharp or dull, and I'll have your eyes closed for most of these tests. But just a good information sharing, especially for the video. Diabetic patients, they have a lot of problems with their distal extremities and feeling, having a sensation. So this would be good for a diabetic client, but you're not diabetic, right? Okay, so that's good. So like again, with diabetic patients, it'd be good if you're assessing areas like the feet and the toes. So that's good. But anyways, you felt the dull on the sharp side. So now go ahead and close your eyes. And I'm going to be using different sides. You tell me if it's dull or sharp.
Dull. Sharp.
Good. Here.
Dull. Sharp.
Good job. All right. And now moving on to the next. And this one's called the stereo neurosis or stereonosis. Sorry, stereonosis. And this one, what I'm gonna do is place a common object in your hand, and I'm gonna have you close your eyes. You don't know what it is right now, and then I'm gonna put it in your palm, and you just tell me what it feels like. You know what it is?
Paperclip.
Paperclip. Good job. So that's good. The next one is going to be graphesthesia. So what I'm going to do is have you close your eyes, palm out, and I'm going to write a number in your palm. You tell me which number on this row.
3.
Good job. All right, and the next one is going to be point lateralization. So what I'm going to do is have you close your eyes, and I'm going to be touching you. Now open your eyes. Where did I point? Okay, one more time. Good job. Okay, the next one is a 2-point discrimination test. So what I'm doing is using an object that actually has 2 points and then one with 1 point. And I'm going to ask you, I'm going to be putting again on various places on your upper and lower extremities, but you tell me if you can feel the 2 points or if you feel the 1 point. So go ahead and close your eyes. 2.
1.
1.
2.
Good job.
1.
Good job. Thank you. And the last one is going to be extinction. So this one, I'll have you close your eyes, not yet, and I'm going to be touching you at different spots, but you just tell me if you feel it on the left side, right side, or both sides.
Left side. Right side. Both.
Good job. Okay. And now I can actually move on to the deep tendon reflexes, which is the last aspect of the exam. So what I'll do, take my reflex hammer, or yes, my reflex hammer. First one I'll be assessing is the brachioradialis, both. So just go ahead and relax your arm. Right there. Good job. And the bicep. And then I'm gonna actually have your arm, just let me hold it to make it dead weight. And I'm gonna. Okay. Same thing on this side. Brachioradialis. And the bicep. Good job. Relax your arm completely. Good job. Okay, now I can move down to the one that's most commonly known when people think about testing for reflexes, the patella. So I'm gonna come in here, and you completely relax. And what also help you stay relaxed is you pulling your hands. Okay, I'm gonna cover this side. Go ahead and relax. Okay, good job. And then I'm assessing the Achilles now. Go ahead and relax. Good job. Assessing this side. Okay, here, do it more. That's good. Okay, and then for the last two, I'll actually have you lay on your back. And the cochlear one is I'm actually going to be applying a little bit of pressure. It's like a scratch that I'm going to be doing across with this dull end. You know what I'm doing is running across your stomach and looking for any contraction or movements. Do you feel that?
Yes.
Awesome, thank you. And now we're assessing for the Rovinsky reflex. So I have in your feet, and I'm assessing for any plantar flexion. So I'm gonna start out from the heel, I'm way up laterally, come back medially. See your toes flex. Same thing, I'm gonna come over here to this side, do the same thing. I did see the toes flex, flex. So plantar flexion in adults is normal. In babies, they would actually fan out, but that is not a normal sign with adults, but that's actually good. And then that actually completes my neurological exam. Thank you.
Thank you.